Welcome to the Professional Patient Podcast. I'm your host, Michael A. Weiss, and in today's episode, we're going to talk about how to use technology and social media for your health. Now, my objective here is to create a sort of a reference starting point, because these things start changing daily, weekly, etc. So try to look at everything from that perspective. And the way I'm analyzing this, I'm breaking it down into 3 lists, and I'm going to go through everything on the list and cite some specific examples. The first list is going to be about what sort of technology is out there. What are people using? The second list is going to be, well, okay, we know what they're using. What are they asking? So the second list is going to be about the queries. The third list is going to be about social media. What are the different social media tools? And that sort of has its own list because I think it deserves elaboration because it's clearly the fastest growing aspect of technology tools that we have to use for our healthcare. The first list we have is the list of technology tools. Let me go through them. Search engines, Google, Yahoo, niche search engines, whether it's healthcare, industry niche, or niche in terms of the results that you'll get back. Maybe you only want pictures or video files, etc. Then we have healthcare portal websites. I give some examples. WebMD, Drugs.com, AOL Health, iVillage.com. Now, these are sites that ask you to trust them. You go there, you give them your information, really a lot of personal information, and you're showing them that you trust them, and then they go out and get any and all information that you need or want related to your particular illness. These are probably one of the fastest growing areas of technology tools available to people trying to use technology for their health. Next we have social media. Now, social media distinguishes itself because it's all about user-generated content. So credibility is always an issue because the source of the information is something you always got to take into consideration. And that's why I give it its separate list. That's the third list, because I'm going to go through how to use social media. You can't trust everything, but I think if you use it knowing certain things, you can get the most value out of it. So for now, let's just say that social media, things that fall under social media are Twitter, Facebook, blogging, podcasting, YouTube, etc. Then we have the mobile phone. Now, with the mobile phone, depending upon the type of phone you have, there's tremendous technology tools available to you. But for the purposes of this list, let's limit that to the software applications for healthcare, whether that's about fitness, about health, about diet, list of doctors, disease organizations, etc., or using the phone memory card to put your vital information. For example, the drugs that you're on, the surgeries that you've had, your recent blood tests, whatever is most important to you, or perhaps, God forbid, you had an emergency and you could talk but you couldn't move, you could tell someone, oh, it's in my phone, just access the memory card, you'll get all the information there. Next, I list Google Reader and My Yahoo. These are Google and Yahoo tools that act as your home base on the web. They're basically information aggregators. Again, you could sort of set them up like these healthcare portal sites and have them go out and grab, for example, the New York Times Health section every day. Very valuable, very easy to use. I personally use My Yahoo, think it's wonderful. Next up is specific disease and condition websites like diabetes.org, breastcancer.org, and ccfa.org. ccfa.org is the Crohn's and Colitis Foundation of America. It's a wonderful website of fantastic information regarding books written on these illnesses, doctors who treat it, medications, patient testimonials. It's a really good starting point. It's a good ending point. I mean, there's a community there, and I think almost every illness has sites like that. Just find the one that best suits you. Next, I list health insurance and healthcare provider websites. I use Humana as my health insurance, so when I go to Humana.com, I'm able to manage my health care in terms of claims and explanation of benefits, but because they want me to use their policy in the most efficient and effective manner, there's a ton of great information on the website for how I could better use my pharmaceutical benefits or the medical benefits, so don't overlook your health insurer's website. In terms of healthcare providers, I also include the MayoClinic.com because the Mayo Clinic has such a great reputation throughout the world. Well, it does the same thing online. It takes information that's been accumulated by way of the Mayo Clinic over, I don't know, 100 years, and you have access to it online. So you could learn more about your illness, you could learn all about doctors, and they also are starting a social media component, which I'll get into in a minute. Next on the list are news websites like CNN, Huffington Post, New York Times Health Section, MSNBC. Well, look, health plays a huge role in the day-to-day news cycle these days, so obviously these websites have great information. Now, in particular, the Huffington Post last week ran a really interesting article about doctors who use Twitter. So not only is it about health, but it's also about using technology and social media for your health. And I just happened to cite Huffington Post, but I've seen articles like that in these other websites as well. Then we have government websites like the CDC and the FDA. Obviously, if there's a food recall, it's a great resource. God forbid there's a pandemic, it's a great resource. And also, if you're an American living abroad, like folks in Japan who are going through that really unfortunate tragedy, they could go online and find out information about evacuations, about radiation, etc. So it's very useful on a day-to-day basis as well. I also list Google and Yahoo keyword alerts here because, again, if you're a member of Google and Yahoo and it's free, you could use this tool. It's very easy to use, and all you do is you set it up to sort of go out and look for a particular word or a phrase, and at the end of the day, it aggregates all the information and sends you an email with all the articles. It's great. Next on the list are drug company and specific drug websites. I list Pfizer. It's a wonderful company with a long list of drugs, and they give you great information about the drugs, side effects, lifestyle recommendations. And I list a specific drug made by another manufacturer called Cimzia because it's a drug I take for Crohn's disease, and it has its own website because it's a wonderfully effective drug, but it has a couple of side effects you need to know about, maybe some lifestyle issues. So they do the patient consumer a great service by putting this information online. Next is accessing terrestrial radio stations on the web. Now, not every healthcare radio station that you'd like is available on the web. But if you search through Yahoo or Google, you may get lucky. One radio program in particular called It's Your Health with Lisa Davis is one that I sort of participate in. I'm a correspondent, I guess. And if you did a search on it, you'd find that it's available on KLPW, and if you click on it, you could actually listen to her show whenever it's on. You could go to her website as well. So I just use her as an example, but whatever your healthcare show is, try to find it. You may get lucky. Then you have, of course, Sirius and XM satellite radio. They have a particular station called Doctor Radio. 24 hours of programming all about healthcare. It's really interesting. And then you have specific hospital websites. Again, I mentioned the Mayo Clinic, but in this context, I'm talking about a hospital asking patients to sort of do a 2-minute video testimonial about how great it was to have their knee replacement done at a particular hospital. And again, that has to do also with the quality of the medical staff, quality of nursing, so you could also always get information from the hospital's website. The next list has to do with the queries we're making. What type of healthcare information are we seeking when we use technology? So let's go through the list. First, specific medical treatments and procedures. Obviously elective surgeries, cosmetic surgery, even medical tourism. I mean, people are traveling to India and Thailand for medical procedures, and obviously you could find out a great deal online. Next is doctors and medical professionals. We all want to seek information out about our doctors and other medical professionals. Are they board certified? Are they accredited? What are these alternative medicine credentials mean, etc. Then you have patient recommendations. Obviously, there are testimonials about doctors and procedures. There are patient tips about drugs and managing side effects and the best way to recuperate and deal with physical therapy, etc. Then you have alternative medicine, which is, I think, a fast-growing aspect of what people are looking for. Could be acupuncture, supplements, disease diets like for Crohn's disease or breast cancer or kidney disease, etc. Next is hospitals. I mean, some people with their health insurance might actually have a choice of hospitals they can go to for a specific procedure. And then there are different certifications for hospitals. One in particular, the Magnet, M-A-G-N-E-T. That's sort of a nursing certification, but it does designate a degree of excellence. So some people are looking for that, just like they're looking for visitation policy, semi-private rooms, etc. Then obviously there's health insurance coverage and health insurance appeals. And in doing this, people are also seeking pre-certification information. What do they have to do? What's the procedure? Some people want to compare insurance policies. Some people want to know what the process is like to appeal declination letters for coverage. Another query that people use has to do with drug side effects. People could be on prednisone or other types of steroids, and they're wondering why they're having all these wacky side effects. Obviously, cancer treatments, experimental medications. Now there's sexual health issues. I don't know from first-hand experience. I've never had to do this, I swear. But from what I've read, people say they look up performance issues, performance with respect to drug side effects. Teens may be looking up sexually transmitted diseases, etc. Now, one of the more popular queries has to do with pregnancy, parenting, and childbirth. These are primarily women's issues, and the website iVillage.com does a great job. But there's a whole host of information on this stuff, and you could get lost in it, but it's there. And I think a lot of people look for this information, and it leads them to other information like books and therapy, couples therapy, and parenting, and blah. It goes all the way down the line. So there's a lot of information there. Then you have aging and Alzheimer's. People get concerned about their loved ones. They sometimes look up dementia. What are signs of it? What's the progression? How do we prevent it? How do we cope with it? Etc. Then there's long-term care nursing home issues, from the cost to the financing to how they screen their personnel. You want to know if you're going to entrust your loved ones to a facility, how are they hiring people? Medicaid, estate planning issues like elder law issues. Then I listed here interpreting medical or laboratory results, like blood work. I mean, I have to get blood work every month, and there's so many symbols on there. If my doctor says it's great, I don't know what that means. I want to know what those symbols mean. I want to know what the norm is. How am I doing against the norm? Same thing with diagnostic test results. Technology is great for that. Next on the list is managing chronic illness and chronic pain. And much like with pregnancy, parenting, and childbirth, this is a wide spectrum of issues that people are seeking information on, from medications to pain management physicians, to supplements, lifestyle coping tips, you name it, people look for it. And there are communities of people with chronic pain who sort of inspire each other, they commiserate with each other, etc. Thank you for your time and attention. If you get a chance, please subscribe to the podcast because it's free. It would help me out a bit in the future. And if you have any questions or comments, please feel free to contact me on Twitter. My address is @hospitalpatient, that's one word, or email me at michaelweiss@hospitalpatient.com. Thanks.